Well, this little kitty came in late in the day because the owner found something strange in its side. Sometimes late in the day when we're closing up, we'll just use the box anesthetic, and especially for a young, healthy cat. And then we found this thing sticking out of its side. And it's kind of weird looking, isn't it? Well, I'll show you what it is when we get it out. But I, oh, there it is. It's a fish hook. And I have to kind of see what I'm going to do by pushing on it and see where the end of it is, where the pointed end, the hook is. And I'm trying to determine where the hook is under the skin, because we have to push it all the way through and usually cut the tip off. So I'm going to shave up now that I understand where it is and where I have to push it through. So we shave it up and prep it up a little bit. And it's not in a really a clean incision though, because it's been abscessing in there for about a week. So I'm going to use my blade and feel where the point is and then cut down on it to try to liberate that hook, because I tried to pull it out through the wound and it wouldn't come. So I know I have to push that barb straight through. So you'll see the, the, the hook come up, and then once the barb's free, then sometimes I can cut the barb off with wire cutters, and then I can pull the lure back out through the entry hole. So I'm trying to get the barb out to where I can see it and see what kind of barb it is, and push and get my wire cutters in there to cut the barb off. But in this case, what happened was when I tried to cut the barb off, it just came out through the hole I made. So that was great. So there it is, the cleaning up the wound now, um, and trying to enlarge that exit hole, or the hole I made where the tip came out, so that it can drain. So I'm going to enlarge that hole so it's nice and big so it'll drain nicely. And then I'm going to clean it up really good and clip up all the hair on the other wound, to try to get it clean so it heals nicely. And of course, we're going to use antibiotics and for a period of a couple weeks and recheck that wound to make sure it's okay. But we're cleaning that wound up and clipping it up, and we disinfect it a bunch and flush saline through it in order to get all the stuff out. And it's nice and get nice and clean out. Blood is a good thing. Pus is a bad thing. Blood is a good thing. And that's what was stuck in the wound. That's pretty amazing, huh? I don't know what kind of lure that is, but it's not a cat lure. After I said that, I realized it is a cat lure, isn't it? Because it caught a cat. It was in there for about a week and festered or got infected. And I used gas anesthetic because I wanted the kitty to wake up right away, because we were closing up on our way home when the client walked in. But anyway, check out Dog Dish Diet. I wrote 3 books: Dog Dish Diet, Feed Your Pet to Avoid the Vet, and Dog Diet Answer Book. And it's all about feeding your pets better recipes. Feed Your Pet to Avoid the Vet has tips for feeding cats and recipes for cats. Years ago, when I started cooking for my dogs, I realized that what we feed our pets, our commercial diets, are often not as high quality and very processed. So I wrote these books to emphasize better ingredients for our pets. It causes improvement in a lot of chronic illnesses and can even prevent them. Have a great day.